Hey there, future nurses. Today, we're tackling a scenario that highlights just how critical proper communication can be, especially when working with hospitalized children during intimate or invasive procedures. Let's walk through a case where poor communication led to serious consequences. The scene is set. A nurse enters the room of a 5-year-old girl who is scheduled for a sterile urine collection via catheterization. Her mother has stepped out briefly to speak with a physician. The child is resting quietly, unaware of what is about to happen. The nurse proceeds with the preparation. She speaks briefly to a colleague but does not explain the procedure to the child. No introduction, no explanation, no reassurance. She lifts the blanket, exposes the child, and begins the procedure while holding the girl's legs apart. Suddenly the girl screams and tries to pull away. She cries loudly, trembling and panicked. By the time the mother returns, the child is inconsolable. The procedure is completed, but the emotional impact is undeniable. Here's the issue. The nurse initiated an intimate, invasive procedure without any communication, consent, or psychological preparation. The child felt violated, powerless, and afraid. A lack of basic communication and empathy turned a clinical task into a traumatic event. Let's be clear, this was a critical failure. The nurse failed to recognize the child's right to understand and emotionally prepare for what was coming. She also failed to wait for the parent's return or involve any trusted adult in the process. Trust was broken. The child's sense of safety was compromised. What should have happened? The nurse should have explained the procedure in simple, age-appropriate language, ensured the parent was present, and asked for the child's cooperation in a respectful, calm manner. She should have created a sense of safety and control, not fear and confusion. Takeaway? In pediatric care, communication isn't just a skill, it's a responsibility. Children deserve to be informed, supported, and respected, especially during vulnerable procedures. One moment of neglect can lead to long-term emotional consequences. Until next time, practice with empathy, communicate with clarity, and always protect the dignity of your youngest patients. You've got this.